6 years ago. Very tragically, my wife got ill, and the only real way that she could have survived was if they were able to diagnose it earlier and more certainly. And that was the beginning of me looking into the challenge of how do we detect cancers and how do we classify them more certainly, more quickly.
Radiologists today are looking at more scans, more slices per scan, and much higher resolution per slice than ever before, and that's only increasing.
The bottom line really is that radiologists increasingly are playing a greater and greater role in patient decision-making and patient care. We need to maintain our high level of accuracy, but how do you do that as the volume and complexity continue to go up? And I believe smart solutions, whether you call them artificial intelligence or machine learning, are going to be the key to radiologists being able to continue to serve their patients in a healthy and safe environment.
2 billion people are going to join middle class in the next 7 years. You can't create enough radiologists to support all those 2 billion people. At Zebra Medical Vision, we are on a mission to create as many of the machine learning algorithms that will help existing radiologists detect diseases earlier and prevent illnesses and death, but also to help billions of people to get affordable access to healthcare.
Here in Oxford, we conducted a study looking at 100 CT scans. Zebra was sensitive in 95% of cases and was specific 100%. The impact of Zebra on healthcare is huge.
At Intermountain Healthcare, we're in the midst of a transformation, moving from volume-based to value-based care. So with regard to what we're actually seeing with the Zebra algorithms that we're deploying, we're in the phase of working to bring those algorithms and their results into the primary workflow of the radiologists.
Our products are on the normal workflow of the radiologist. Whenever he opens up a scan to diagnose it, our widget pops up and is showing the analysis of the algorithms.
It's very important for us in Zebra to make these diagnostic algorithms available for developing countries in a very affordable way.
At Zebra Medical Vision, we want to lead the way from sick care to healthcare and make sure everyone's health in the world gets better.
My first question for you really is focused on Zebra, which is an Israeli medical imaging startup that uses machine and deep learning to build tools for radiologists and has raised over $50 million in funding from well-known investors. What is Zebra's origin story and how does the technology work?
So Zebra's on a mission. We're on a mission to transform patient care by teaching computers to automatically read and diagnose medical imaging studies. Now, medical imaging is already established as one of the most critical and influential domains in healthcare. I'm talking about the use of X-rays, CT ultrasounds, MRIs, and other imaging modalities to diagnose patients. So over 3.6 billion imaging scans are taken globally every year, dealing with any condition really, such as prenatal and breast screening, cancer detection, cardiovascular disease, chronic pain, acute injuries, and image-guided interventional therapies. Basically every aspect of healthcare is touched on by imaging. And the challenge, as was alluded to in the video, is that with the continuous growth in medical imaging volumes and complexity, we're quickly reaching the human limit for effective interpretation of these images. And so at Zebra, we're really looking to empower healthcare providers to manage this ever-increasing workload without compromising quality of care through the use of AI and machine learning. So an average radiologist reads about 50 CT studies a day. Each study has about 400 images. So that's 20,000 images per day, which means that every radiologist spends roughly 1.6 seconds reviewing every image. And we believe there's a significant role for technology to play to alleviate some of that. And a major part of what makes machine learning so valuable is its ability to detect what the human eye misses. So machine learning models are able to catch complex patterns that would have been overlooked during human analysis. So we might all be good at sifting through a massive but organized spreadsheet and identifying a pattern, but machine learning and artificial intelligence algorithms can examine a much larger data set, and they can understand patterns much more quickly if you train them properly. So back to Zebra, our AI solutions help radiologists by automating the interpretation of medical images for certain types of conditions. I like to think of it as an autopilot solution in a long transatlantic flight. And there's a very good symbiotic relationship between the autopilot and the pilot, right? You wouldn't want the computer to do the takeoff on its own, to fly the plane for 12 hours in bad weather, and then to land it solo. But on the other hand, you're also very happy to know that there's a computer, there's someone supporting the pilot on such a long journey. And so that's really how our products work. They receive a copy of all of the scans that are taken at a particular hospital, and then our software reviews the images and provides an initial diagnosis even before the radiologist has ever looked at the exam.
But one thing that is clear is that coronavirus clearly places a big burden on our healthcare infrastructure. We're seeing a limited supply of ventilators and hospital beds available. How has Zebra's use of machine and deep learning helped alleviate the strain of COVID-19, and that's made our healthcare industry a little bit less stressed out currently?
Mm-hmm. No, absolutely. I'd say that most efforts to fight the COVID-19 pandemic to date have really been on characterizing the virus, on testing it, or on vaccinations for, and building immunity against it. I think there's been very little focus so far on helping the health system understand the potential for disease progression in patients, and really based on that, therefore, how to create the best care plan. So, if you look at it, one of the greatest drivers of coronavirus-related mortality is the inability to detect early potential severe cases and provide critical care to those who need it most. So healthcare providers really need automated tools to support triage and to determine how to best allocate their most valuable resource, which right now is emergency room capacity, is ICU beds, and is ventilators. And you want to be able to do that based on disease progression. I think Italy serves as a cautionary tale where frontline work providers had to make some very difficult decisions about who they think had the greatest need to receive treatment. And what we're working on at Zebra is we've developed software for a machine learning algorithm that analyzes CT scans. And that software automatically detects and quantifies suspected COVID-19 findings while providing what we call a lung burden score, basically a calculation of the percentage of the affected lung volume. And that enables providers to better predict the trajectory of patients with COVID-19 as a decision support tool for the allocation of ER and ICU resources. And we're proud to say that we're leveraging a patented algorithm that Zebra developed in the past for detecting what are called ground glass opacities, that they're kind of a dominant imaging feature of the COVID-19 pneumonia. And we also detect a pulmonary consolidation. And those two factors through our technology can be segmented based on 2D or 3D slices of an anatomical image. And we really started this project just 5 weeks ago. I think like the other speakers today, this is a good case in point of just the ability to revector quickly and identify an opportunity where we could add value. So we took kind of this legacy patent that we had that was focused on ground glass opacity, a component that can lead to lung injuries. And then we redirected that effort to really focus on how to translate that for a detection and progression module for COVID-19. So we're using clinical data from thousands of medical images to train the model, specifically on COVID-19, and then we're validating that against confirmed COVID-19 CT scans, which are actually still relatively hard to get to because most jurisdictions are only starting to really build up a database of chest CTs for COVID positive patients. But as we roll this out, our software will offer key insights into the disease severity and will really enable doctors to diagnose, treat, and evaluate patients much more swiftly and effectively, hopefully.
What partnerships has Zebra established with certain US-based hospitals, healthcare companies, insurance companies to help detect and ultimately prevent the spread of COVID-19 as well as beyond the virus itself?
Yeah, maybe I'll start with the second part of the question of what are we doing beyond the virus, because we've really been building up our global presence over the past several years. And then I'll touch specifically on where we are with COVID-19, which is still, really just in the rollout phases. We just deployed our first kind of our proof of concept of the solution last week, and now we're starting to gain traction with installs that are coming up in both Israel and the US. But I mean, overall, the main customers for Zebra software are payers, providers, and medical device companies. I'll give maybe two examples of partnerships that I think are pretty unique. And the first one is with Intermountain Healthcare. So you heard Dr. Keith White, the medical director for imaging at Intermountain, speak on the video. Intermountain is one of the really top hospital chains in the U.S. It's based in Utah, 23 hospitals. shifting from a fee-for-service to a fee-for-value environment. And we've partnered with them both from a data standpoint as well as from a workflow and productivity standpoint. I think you're probably aware that in machine learning and AI, one of the biggest challenges, like the previous speaker had noted, is getting your hands on data. And that's probably the strongest asset that Zebra has in collaboration with Intermountain and also with Clalit, which is the largest HMO in Israel, and actually the second largest HMO in the world after Kaiser Permanente. We've been able to secure an imaging database of over 30 million patients, and that includes over 500 million imaging procedures, and also the full longitudinal record of these patients. So basically going from the order to the images to the report that was done based on those images and the full medical record. And that really allows us to have substantial richness in our data set so we can train the algorithms based on new conditions as they emerge. And that was a big part of our ability to respond so quickly to the COVID-19 crisis, is really leveraging the data from Intermountain and from Clalit. And so we're deployed across all 23 Intermountain hospitals, and we work very closely with them to pilot and to test out new solutions. Maybe another partnership that I'll touch on is Johnson & Johnson, which also came in as an investor into Zebra. And with J&J, they have a wide variety of business units that do all sorts of medical device and different interventional procedures. And so we are currently working with their knee and hip replacement division. And what we do there is we allow them to take a two-dimensional images, so basically an X-ray, and create a 3D model out of that image to have a much more accurate procedure plan, which minimizes waste when you're coming in to do a knee and hip replacement, because now the implant is just much more accurate. It was built on a more detailed and refined model. And also that will ultimately allow J&J to move into the field of robotics, because they can achieve far greater accuracy in the data set they use for procedure planning. So those are two examples of partnerships that we're leveraging to drive our roadmap forward and also to have a strategic impact. And those are the kind of partnerships we like, where it's both a customer, but also an investor, a strategic partner. Specific to COVID, where we are right now is, as I mentioned, the solution is out really as of this week, kind of our first pass at it, and it still has to be refined using more live data. And so we'll have our first two sites go live in the coming week. One will be at Beilinson Hospital in Israel, which is the COVID hospital for Clalit Healthcare. They're centralizing all COVID care there for the vast majority of the population in Israel. And then the second partner is in New York State. We're partnering with one of the large health systems and really, again, recognizing that they're at the epicenter of that challenge of making the difficult choices around capacity, right? How to deploy ICU beds, ventilators, and they really need tools to make more informed decisions, especially prospective ones, right? Not looking in the rearview mirror, but being able to predict what will be the trajectory of a patient. And so we really kind of rose up to the challenge and are working to help them out.
That's very exciting. Which healthcare system is that? Can you say?
Yeah, it's Northwell Health so that's actually the largest system in New York State.